Let's go beyond the connection. Welcome to the podcast, everyone. I'm Steve McDonald, your host. And today we've got a really interesting guest on, Falko Buttler. And Falko, you are not only the Chief Technology Officer of a really interesting company in Lantern that's doing incredible things to help reduce costs for us consumers in the healthcare industry. So we're going to talk a lot about that today in terms of what's going on in the industry and from a technology perspective, what we can be doing. You've been in healthcare your entire career. In fact, you were the founder and CEO of an early app on the App Store, a health app. I want to have you explain it a little bit better that went viral. I thought it was just fantastic that you have that kind of a background. In fact, if you wouldn't mind, maybe just expanding a little bit more on your background beyond that, then we'll dig right in. Because our goal here today is to talk about the future of connected care and why incremental change wins in healthcare, not wholesale changes. We're going to dive deep into that, but I'd love to hear a little bit more about you first, if you don't mind.
Yeah, absolutely. Thanks for inviting me to your podcast. Super happy to be here. Yeah, I'm currently CTO at Lantern Care. It's a specialty care network, and we help our patients and our customers that are typically self-insured employers save money and have high quality care around surgery, cancer, and infusion. But in my past, like you mentioned, I built one of the very first health and fitness apps for the iPhone back in 2008, when that literally the iPhone just came out. And that app went viral, and I sold over 1 million copies of that worldwide. And I beat Angry Birds in the App Store charts for 3 days in a row. And that is like one of my big achievements. And then I also helped 2 early stage startups in Silicon Valley go from like really early stage, finding product market fit through scale, and then acquisition and going public. So I really like this space, really excited about healthcare, and really excited to talk to you about that.
Well, so one of the first things about healthcare that I'd love to get your point of view on is you talked about it, that there's lots of friction in healthcare about the data and the way that we communicate and HIPAA laws and compliance and all kinds of stuff. But you talked about that it's almost designed in, like resistance is part of the system by design. I just love to hear a little bit more of your thoughts on that to get us started.
Yes, I'm a strong believer that obviously healthcare is like an old industry, and it has been around for a while. And like whenever you have like a legacy system, then things grow differently. But I also believe there's actually friction built in by design to make it intransparent, to make it harder to navigate, to have like no price transparency. I think that is by design so that you can make money within the system, which would maybe not be quite as easy if it would be a lot transparent. I always say lots of the companies I worked for in the past shouldn't exist if we would have a well-defined, open and transparent healthcare system with the easy access and supply. But unfortunately, that's not the case. And that's why I do what I do.
Well, every industry lacks a degree of transparency, connected data. We live with fragmented, siloed data. And healthcare, oh my goodness, a lot of what you're doing in bringing down prices, just understanding the price of, I have to go in for a knee surgery, and how do I even evaluate? How do I even know what it's going to cost me until I go through in the end, and all of a sudden I keep getting bills from like everywhere. Tell me a little bit about, you talk about broken communication standards in the industry. And I'm sure that's a big part of what Lantern is trying to break through and provide transparency on.
Yeah, I think there have been standards established now, and it took a long time to get there. So now, theoretically, at least, every provider and hospital system is supposed to share medical records and basically the patient's history with the broader system. That is the good news. The bad news is that doesn't really happen consistently. Some providers do it consistently, some others don't do it at all, some do part of it and not everything. So unless everyone is really contributing to it, it doesn't really help. And that contributes to the friction, which then means you need to try to retrieve that information elsewhere by calling providers, by faxing them through different mediums, trying to get to that data. And that costs time, which ultimately leads to delayed care for the patient who really needs help.
You actually even talked about there's just gaps. You call them like pricing transparency gaps. How does the lack of just transparency upfront in pricing affect both not only the patients, but the employers, the whole ecosystem here?
Yeah, I think this is the only industry where you go to some place and you don't know how much it's going to cost. Like imagine going to a restaurant and you're ordering some food and the menu have no prices on it, and you ask the server, "How much is this going to cost?" And he's shrugging and saying, like, "I don't know. I'll send you the invoice 8 weeks later, and then you have to pay whatever I'm telling you you have to pay." This is basically how it is in healthcare. You walk into a clinic and you know exactly what procedure you need and you know exactly what you need, and still they won't be able to tell you. And even worse, you can go to 10 different providers and get the exact same service. And let's say it's even the exact same quality, which is obviously not true, but still you would get 10 different prices at the end. And pricing is not really correlated to quality either. You may pay a really high price and still get very low quality, or have very high quality and actually have the lower of the 10 prices. It's not really correlated, and that is because it is completely intransparent. So that's how you get there.
So, how does that like in a day and age where we've got AI, we've got more access to more data than we've ever had before, but in the healthcare world, they're still using things like faxes and CDs and things like that. There's this balance of really incredible latest, newest technology that's available. And then things that we feel like we're still in the dark ages, right? How does healthcare bridge the gap there? How do you work within that kind of an environment?
Yeah, that is true. Unfortunately, if you request medical records, often you receive a CD by mail. I don't even have a CD player at home anymore. So you really work with that. I mean, you can still try to apply modern technology despite the fact that you use these old systems. For example, you could use AI, like OCR and AI, to read faxes electronically, process them, and kind of extract the irrelevant information from it and then hand that over to whatever group needs to handle that, or even a machine or like an agentic system processing majority of these cases. Now you have fax on one end and you have an agentic system on the other hand, like a technology from the 70s and the technology now working hand in hand to make this work, because you cannot eliminate the fax in the equation. Unfortunately, that requires legislation to change, and that is going to take a long time, but you can still work within the system.
So you talked about layering in incremental gains, that trying to come in and say, we're going to do a wholesale kind of like upgrade here. It obviously needs it, right? But why do you talk about layering in incremental technology? And why is that the way to go?
I think it's really hard to change the system all at once. Whenever you want to upgrade a system, whether it is like your own legacy system or like a broader legacy system, I think the best way to go about it is going at it incrementally and improve it in small chunks along the way until you eventually have everything improved. But it's going to take a long time, but the friction is not as big. And also, if something goes wrong or it's not quite working the way you expected, you can adjust rather than trying to do a big bang and you're working on it for years and then you're making a change and then it's not really the outcome you're expecting. So that is like how regular, like agile software development works as well. And I think the same can be applied to a healthcare system as a whole.
And you actually, in your development process, you talked about kind of shifting mindset to more monthly releases, to daily deliveries, to like instead of working on big large chunks of technology and coding at once, you're working in smaller pieces. How has that helped how you're providing services to your clients, but how has that impacted internally your development process too?
Yes, I'm a strong believer in continuous delivery and pushing incremental changes as quickly as possible. And that can mean daily or multiple times a day rather than like monthly or bi-weekly, which is kind of a more traditional development process. And interestingly, most people think if you push code a lot faster, then the quality can't be that good because it's impossible to test everything every single day and make sure everything still works. But actually, the inverse is right. The faster you push, the better your quality is going to get, because the incremental changes you make are so small that, one, they're easy to test because they're very small, but also if something now doesn't quite work, you know exactly what caused it and can either roll it back or make a quick fix. Now it requires some infrastructure around like automated testing, etc., but it is still a lot better in the long run. And you can provide new value immediately rather than waiting. So now imagine a product manager has an idea, it gets into a sprint, now the team works on it, but they just missed the release like cutoff, and now it has to wait for the next release. So now in the worst case, it could mean maybe it's another month that someone needs to wait for this feature to go live. But now if you have continuous delivery, as soon as the thing is done, it can go out. So you don't have that delay from something being finished to actually having an impact on your customer base.
So it's really interesting because in these days, the customer, if something goes wrong, whether it was a big release and something within that big release broke something and now it's not working, right? Or it's just there was an outage on your network. There's like a number of different ways that the customer experience can get broken. It makes sense from every standpoint, the daily releases and slow testing or rapid testing. How do you think about the other side of that, which is just keeping the app up and alive, the experience alive for the customers? In healthcare, there can't be a more important category where access to data impacts care and impacts lives. So this has got to be something that's just completely top of mind every day.
Yeah, of course. I mean, we're providing a healthcare service, and that means one, we need to protect our customers' data. That is like a top priority for us. So internally making sure that that data stays safe, and externally making sure it's safe from some external forces. But at the same time, we also want to make sure our system is always available so that we can provide the service. We are providing some really critical service. Like imagine someone going through like a cancer journey. We want to make sure we are there for them anytime they need us. And that's also why we're investing in modernization of our infrastructure, making sure we're using the latest and greatest to have auto scaling available as we scale our business, as like demands shift during the day, during the week, or even seasonal. Typically, like at the beginning of the year, we have a lot more demand than maybe during the summer months. So adjusting to that as well, I think it's important. And I think lots of healthcare systems are somewhat outdated. I think there's a lot of opportunity to really modernize and being more available for your customers.
There's going to be a lot of CTOs, director of IT, a lot of technology leaders that are going to be listening to this. And what would you give them as modern strategies today on the network and the things that you're doing to make sure that in a healthcare environment like this, that you never go down? What are some of the ways that you think about that you could share with us today?
Yeah, I mean, I'm thinking about getting really technical now, but like Dockerizing your services, using something like Kubernetes for auto scaling so you don't have to manually watch and spin up new compute as demand spikes or bring it back down to save cost. Also having that manage like how much compute does each service need so you're optimally distributed across how much memory and compute something needs. Also using things like infrastructure as code rather than someone manually going in and kind of tweaking assuming you're on the cloud. That to me is like another one. Like think about if you're still on-prem, moving your infrastructure from your own data center or your own place to the cloud that just enables you to scale as much as you need that, or quickly change from a smaller instance to a larger instance, which would be a lot harder if you have your own infrastructure. Managing your infrastructure through code so you know exactly, one, it is repeatable and you have templates. You also know exactly what changed and can quickly address it, and things like continuous delivery go hand in hand with that. So if you introduce some bug that causes some instability, you can quickly react and resolve that as well. So these are just some of the things you should be thinking about.
I appreciate that because our conversations have been really interesting because they've been highly, highly technical, but then you went into an area that I think as technologists, we all really need to understand and pay a lot more attention to. You talked about business alignment, how technology leaders have to have a better alignment with CFOs, CEOs, CROs, chief product officers. Tell me a little bit about like how do you work with the rest of the C-suite and these other departments, and in what ways and why it's important?
Yeah, I think it's incredibly important that the technology team or the engineering team is working one on the most critical business problems or initiatives or like the strategic initiatives that you want the company to work on, and that you are aligned on what that means and how that is being executed. Like, for example, we're going through a massive transformation on for our member services, providing them better tooling. Now, that is a multi-month project, and it's moving from like a legacy system to something new, which requires training, that requires also timing of like, when can we actually roll this out? Like, we shouldn't roll this out at the end of December if we have the peak season at the beginning of the year. So work with your counterparts on what is the right timing, how should this be rolled out, who should be involved, to get to a really shared understanding of what is being built, why it is being built, and when it is being rolled out, and having clear communication across the different departments. So in our instance, we have a weekly executive leadership meeting where some of these are being discussed, but also on a regular basis connecting with different leaders across the organization to make sure we're all aligned and get them into the right meetings as well. Especially with like my product counterpart, a chief product officer, I'm working extremely close to make sure we use OKRs, so the same company OKRs break down into like the product and technology OKRs and how those translate into the projects that we're working on for the different teams.
You know, it's interesting. We would want to believe that this is changing as an industry, but as technology leaders, we often feel like we don't have a seat at the table. We're not in all the strategic conversations. We're treated more as a support department. And what you just articulated is very, very different there. We never really got into the industry thinking, how do we sell ourselves? How do we advocate for ourselves? It doesn't always just naturally happen, but the business trajectory, the strategy, the growth of the business is so directly aligned with the delivery of services that it can't be decoupled. What recommendations would you give to the other leaders that are tuning in today about how do you assume that seat at the table?
Yeah, I think in today's age, people need to realize that it's a real differentiator. The technology that you build is a real differentiator for you as a company compared to your competitors or compared to being better at what you do. And while you may get away with solving it through like manual labor and some other processes, at some point you will reach the point where you really need to invest in the technology to move forward and scale. The faster you get to that point, I think the easier you have it as you go from product market fit to having your first customers to really scaling and go big. I think at Lantern, we certainly reached that point and now have a full understanding. It's like technology is really what's going to differentiate us going forward. And that's why we are making heavy investments, significantly increase the budget that we have for technology to make these changes and work it hand in hand with other departments in the organization to make that work. And I think if you can have that conversation with the CEO and the board and the other leaders in the organization, I think that is going to be significantly helpful for the long-term outcome of the organization.
Just understanding the business of the business. You know, you talked eloquently earlier about customers and customer experience. We have internal customers. We have to understand, just like we have to understand our external customers and their needs deeply, we need to do that internally as well. You've mentioned a couple of times earlier in our conversation here the importance of the experience for the customers. And this is across all industries, but a couple of years ago, McKinsey came out with a study and they had looked at over 400 highly profitable companies, B2C, B2B companies, largest return on shareholder value. And they determined that CX, customer experience, was the number one differentiator in the market today. So CX is super important. Tell me a little bit about how you see your role contributing to the customer experience.
Yeah, on the engineering side, you are literally building the user interface that someone is interacting with. Like now, in our case, we have patients that are obviously our customers, but we also have the employers, the health plans, the unions, the public sector clients that are our customers. like reports, maybe interfaces that they work with, which like engineering or like at least kind of we generate the data. So we deeply think about how can we improve that experience across the board? How can we make it delightful, easy to use, obviously get the relevant information that you want, get it as real time as possible. But it's also like, I think our organization, and that is true to previous companies I worked for, we want to be high touch and kind of provide a white glove service, even at scale, which the larger that you become, the harder that gets to have a white glove service. But really making them feel important and special and give them a treatment, I think goes a long way. Because we're working on healthcare, and I think it's a deeply personal topic. I think if you treat your customers the same way, like in our case, paying customers is really the employer in our case, or the union, and the patient is the one that kind of reaps the benefits of getting the better service, but they're not necessarily paying us for it. But we obviously want to treat both equally well. But I think if you start treating your customer with the same way how you want to treat your patient, I think that goes a long way and also makes like selling a lot easier and keeping your customers happy along the way.
I love the focus that you have on deep integration with the other departments and them and thinking about customer experience. It's so important these days. What's a question I haven't asked that would be appropriate? What haven't we covered that you've got a platform here to talk to your technology peers in the healthcare industry? What else would you want to cover on this that I haven't asked already?
I think for many people, getting into healthcare seems jarring because it's a really slow moving industry. It is, there's lots of regulation, there are lots of big players that like are trying to make your life hard at times. But I still believe there's just a lot of opportunity within that market to really make a difference. The amount of money that is being spent in healthcare is just mind-boggling. I always say, like, Starbucks spends more money on healthcare than they spend on coffee beans, which is just ridiculous. So there's just a massive opportunity here, and I think especially with technology, you can really make a huge difference. And to me, my whole career in healthcare, I just love hearing the examples of real outcome that come on the other side, like the patient that now had an amazing experience, or we help them fight their cancer, or we help them out of a financially really difficult situation because now they were not liable to pay tens of thousands of dollars out of their pocket, or we connected them to the highest quality care or the expert in the field. Well, whatever your example may be, which depends on what company you're at, but I think it's highly rewarding being in it. And I think there's just so much that still can be done. It's far from a mature technology industry.
Lots of opportunity. That's good. If you could look back over your career, 20 years in healthcare and technology, what are you the most proud of?
I mean, besides beating Angry Birds in the App Store, I think looking back, the one that I feel really proud of, like the previous organization where I worked for, we did virtual primary care. And I joined that company prior to COVID. And at that point, seeing your doctor online, having a video call with them just seemed very foreign, just like it seemed foreign to jump into a foreigner's car and let them drive you around like Uber or Lyft. But when COVID hit, our company suddenly became incredibly important, and we were trying our best to expand our network, expand access for people, and really helping them in some really serious situations. And just seeing that play out at scale was just incredibly rewarding because the company has grew tremendously during the time, which is always fun when you see that success. But for me, it was also just about the amount of people we were able to help at the time was just incredible.
Yeah, that's a great story. So I wanted to give you one last question. This sometimes is the hardest one, but we've covered so much territory here, and it's hard. Our human brains can only remember about two or three things at a time. If there was one most important takeaway that you wanted your peers in the healthcare industry, technology leaders in healthcare, to take away from our conversation today, what would be the one most important thing?
Like I mentioned earlier, you can make a real impact with technology in healthcare. But despite all the adverse powers that are going on, you can make it easier, more accessible, less expensive, provide higher quality. You're getting just more connected, making the communication between the different systems smoother, easier. Pick whatever outcome you want to get, hopefully many or all of them at once. But I think there's just so much opportunity by applying modern technology to healthcare to make that better for everyone.
Well, I would love to say that I wish we had 2 hours because this is such a deep conversation, but I know people are gonna have questions. Is it appropriate if I give out a link to your LinkedIn profile that people could find you and ask questions?
Yes, absolutely. Love to connect with folks and answer questions and just socialize other ideas. Yes.
Well, the whole mission here in this podcast is to bring technology leaders together and share from our learned experiences and recommendations and our point of view on how to tackle some of the biggest problems in healthcare and just connecting the data and making things transparent that are really hard to make transparent is one of the biggest issues and challenges that we have to tackle. So I just want to say thank you for coming on and sharing all of your insights and all of your perspectives. It was fantastic.
Yeah, thank you. It was a blast. Thank you so much for inviting me.